Okay, so now we're going to be talking about, is it working? I don't think it's working. Oh, it is working. Okay, so now we're going to be talking about insulin. There are several different types of insulin, and we have them organized by the way that they act, whether they are rapid acting, short acting, intermediate acting, long acting, or the special category, which are pre-mixed insulins. Pre-mixed insulins are going to be a combination of one and another. So you'll see that in just a second. Insulin can be used for type 1 diabetics. It can create a glycemic control of diabetes mellitus to help prevent complications. It can also be used for type 2 diabetics as well as gestational diabetes. There are a few adverse effects that go along with using insulins, and the primary one is going to be hypoglycemia, so low blood sugar levels. This can lead to brain damage, shock, and even death. They can also have an adverse effect of weight gain because we're going to be better utilizing the sugar in our bodies. Lipodystrophy at injection sites. This is especially prevalent with patients who have insulin pumps. Lipodystrophy is the death of the fatty tissue around the area of an injection. So since an injection and a insulin pump is in one particular area of the abdomen, that area has a greater chance of lipodystrophy. And there is a possible chance for an allergic reaction, but it's kind of rare, but there is a possible chance for it. Nursing applications that you're going to want to make sure you have the correct route, correct time, correct type, and correct dosage. Within the rules of the hospital, there's actually required two nurses to do the math to make sure you're giving the right amounts of insulin. Insulin is given with their own special syringes because insulin units are so teeny tiny. They want to make sure that the correct amount, the correct dosage to give your patient. You're going to want to always check the blood glucose levels before giving insulin to your patients. And you don't want to give insulin if your patient's blood glucose level is less than 70. You're going to want to roll the vials to mix them. So I guess let's say if this is your vial, you're not going to shake it up like this. You would do this to help roll it. And if it's an Nph or an intermediate insulin, you would roll it on its side so that you could make sure it's fully mixed. You never want to shake it. You don't want to get air bubbles. You roll to mix. And that also helps to warm up the insulin if it's been refrigerated. When withdrawing insulin in the vials, you would probably have learned this while working in lab, but you go from clear to cloudy, not the other way around. Clear being rapid or regular insulin, cloudy being NPH. So you always withdraw this medicine first and then withdraw the NPH. So there's other specific rules about injecting the right amount of air into certain vials at a certain time, but we're not going to get into that right now. We're just going to talk about the insulin itself. So the first insulin that we're going to talk about are rapid insulins. So it would be insulin Lispro or insulin Aspart. This is Humalog and Novolog. These drugs are for type 1 or type 2 diabetes, and it can be used in an insulin pump or an injection. The patient must eat after having this injection. So you don't give the insulin and say, oh, well, your food tray's coming, and wait for the food tray to get there. You wait until the food tray is in front of your patient, give them the insulin, and then say, here, enjoy your applesauce. Here's your breakfast. Go ahead and eat. So this insulin is given SQ, so subcutaneously. There is an onset of 5 to 15 minutes, peak of 1 to 2 hours, and a duration of 3 to 5 hours. So you need to know that. Rapid, 5 to 15 minutes, 1 to 2 hours for the peak, and 3 to 5 hours for the duration. For short-acting insulin, it's just called regular insulin. The brand name is Humulin R, so the bottle will have a big R on it. They've done that now so that there's an R or an NPH for, well, there's a not NPH, it's just N for the other drug. Regular insulin is clear and colorless. The nursing implications is that it can be given IV, IM, or SQ. Onset is 30 to 60 minutes, peak is 2.5 hours, and duration is 6 to 10 hours. Intermediate is isophane insulin suspension, which is shortened down to NPH. I don't know how it got to NPH, but it did. This drug is cloudy. So remember how we talked about going from clear to cloudy? These are the clear drugs. This is the cloudy drug. So you're going to withdraw this medicine first and then withdraw the cloudy, clear to cloudy. For the Nph insulin, it's given SQ 2 times a day before meals. The onset is 1 to 2 hours and the peak is 4 to 8 hours. Duration is 10 to 18. For long-acting insulin over here, we have Glargine or Detamir, which are Lantus and Levemir respectively. The nursing implications is that this can be used in like a multi-dose pen, but it's for one patient. So let's say that this is the multi-dose pen of insulin. The patient can take their blood glucose level, see their number, figure out, oh, I need to get this much insulin, normally dial it on the pen. I don't know if I can dial it on here because it's just a marker, but then they can inject themselves wherever they need to, and then they can use this pen again. You would not go around on the unit giving insulin from patient A to patient B to patient C with the same pen. One pen, one patient, but they can use that pen multiple times. This drug is going to be given SQ, and you're not going to want to mix the other insulins within the same syringe. Remember, this is like single, multi-use patient pen, but you wouldn't mix other insulins in here. Onset is 1 to 2 hours. There is no peak with a long-acting insulin, and the duration is 24 hours. Lasts a long time since it's long-acting. The special little category over here are your premixed insulins. This includes a rapid or a regular insulin. It added to an Nph insulin. There's normally 30% rapid or regular insulin and then 70% Nph insulin. This simplifies the dosing process. This is less expensive and it's given 2 times a day SQ, but there is not very tight level of glycemic control with this insulin. So since there's 2 different types of insulin in here, use. So just to recap, the rapid insulin onset is 5 to 15 minutes, peak is 1 to 2 hours, and duration is 3 to 5 hours. Short-acting insulin is 30 to 60 minutes for the onset, 2.5 hours for the peak, 2.5 hours for the peak, and duration is 6 to 10 hours. Intermediate insulin onset is 1 to 2 hours, peak is 4 to 8 hours, and duration is 10 to 18 hours. And long-acting insulin, the onset is 1 to 2 hours. There is no peak, but the duration is 24 hours. So those are the different types of insulins and the different onset peaks and durations for them. Yeah, I'll leave it here so you can pause it if you need to. Here's the onset peaks and durations, and that's just a little special note that premix doesn't really have a specific onset peak and duration because it's 2 different insulins mixed into one. So there you go.